Thanks everybody for being here. I'm going to quickly talk about what ICD-10 is and give you some background about how big this problem is for the healthcare industry and talk about a little bit about what we do to solve this problem. Okay, so ICD is the International Classification of Diseases and ICD-10 is the version of the International Classification of Diseases. So ICD-10 is the latest version which the rest of the world has already adopted, but the US is on ICD-9 at the moment. And this was, ICD-9 was created in the 70s before I was born, so I don't know. And when everything was paper-based, and think of the number of discoveries that have taken place over the last 30 years and so on and so forth. So it's a fairly broken system. ICD-9, the code set has 13,000 codes. And okay, let me tell you what ICD is. So whether a patient has a broken arm, leg, or cancer, or a cold, or a cough, or whatever, there's a code for that when the patient goes to the doctor. And that's how the doctor denotes that this is what the patient's condition is. And I'm going to give you an example as well. So going from 13,000 codes in ICD-9 to 170,000 codes in ICD-10. So that's one of the easy parts of the problem. ICD-9 is a 5-character code set. ICD-10 is a 7-character code set. So this is like a Y2K on steroids. That's what we call it. All right. So this affects everybody: providers, payers, clearinghouses, public health companies, so on and so forth. Okay. Now, what CMS did, CMS came up with a mapping system called GEMS, General Equivalency Mapping System. And what the GEMS map does, and I hope I don't offend anybody from CMS here. Okay, I'm sorry if I do, but it's a fairly broken GEMS map. What they did is they said that here's your ICD-9 code and these are the ICD-10 codes it could possibly map to, and they also have a backward map, a forward map and a backward map. Well, what happens in a lot of cases, the forward map does not equal the backward map. So if you go from a code on the ICD-9 side to multiple codes on the ICD-10 side, the backward map doesn't take you back to the same ICD-9 code. So it's a little messy. So now let's take an example. 8470 is sprain of neck in the ICD-9 system. And the GEMS map tells you that it can map to these 2 codes on the ICD-10 side. What it does not tell you is that it should also map to these other codes. So it's not a comprehensive mapping system. And what CMS has said is that every provider, every payer, you can figure out which code you want to map to. It's a free-for-all. So it's going to be fairly chaotic once the October 1st, 2014 deadline comes around for ICD-10. Okay, so it's a huge opportunity because people have not been taking this seriously. They have been very focused on meaningful use. And so this is a recent survey, it's probably a couple months old now, but this is where most people are. The payers have a pretty decent handle on this, or at least that's what they think. But they have not tested this with providers yet, and the providers are nowhere in the running. Okay, the 3 main impacts of ICD-10, hopefully it's running in your mind how big this problem is. So one is obviously on the clinical side because you got to figure out which code you want to map to and which code you want to use on the ICD-10 side. But financial, because now your DRGs are going to shift and your claim amounts are going to change and your reimbursement is going to be all haywire. And thirdly, on the IT side, because heck, if you have 200 different systems in your hospital, all of those need to be upgraded to ICD-10. And your vendors, good luck coordinating with all the different vendors. What can I say? All right. Okay, so a little bit marketing about my company. What we did is we built a module for each one of these problem areas, and we presented this to a number of hospitals, and everybody is like, this is exactly what our problem is. You know, these are the 3 areas how we are affected by this. And so we built a module for each one of these, and I'll just leave the slide up there for a second. So we built custom maps which are much more ahead of the GEMS map. On the financial side, we built a lot of analytics around proving forecasting what your financial upside or downside is going to be. And then on the IT side, we have a fairly good collaboration module and a testing module. And obviously the message is always the same: we can do it cheaper, faster, better. So this is a hardcore marketing slide. And a little bit about us. We've been in business since 2008. We focus on analytics, and that's how we got started. And then, of course, we do other things in healthcare as well. List of our clients. And that's it. Which of your students finished their next study?